Hi, I'm Mitch Mitchell, and I'm doing a different type of video on this channel than I normally do because I've got a bit of a fuss to make. It regards hospitals and flu shots and the healthcare industry in general, but it's all basically surrounding the flu shot. You know, one of the things that has happened over the last 3 or 4 years is that more hospitals are trying to make it 100% mandatory that everybody who works in healthcare takes the flu shot. Now, the basic reason they're doing this is because if they can't get at least a 90% vaccine rate, Medicare basically can withhold upwards of 2% of overall reimbursement that hospitals can get. And for some hospitals, that can end up being a ton of money. Even for smaller hospitals that, it doesn't look like it's as much money, since most hospitals base their budgeting off of Medicare reimbursement, which is stupid in today's age, but this is still what they do. They worry so much about that they're willing to basically sacrifice people's lives in getting a flu shot. Now, that may sound cold for me to say that, but I've got some things to talk about, and I've got some stats to back me up. One little niggling thing that no one really wants to talk about is that there are a lot of people who get seriously sick every year from taking this shot. Regardless of what you're being told by different physicians and hospitals, it happens. How do I know it happens? Because it happened to one of my wife's best friend's sister, who was a nurse, hospital in Buffalo. And her hospital decided to make it mandatory that everyone had to get it unless they had a specific letter stating that they had taken it in the past and had a problem. Now, here's the thing that most people don't know outside of healthcare. You have to sign a waiver. It's a federal waiver. And what it says is you can't sue the hospital, you can't sue the drug maker, and you can't sue the federal government if anything goes wrong with you. You can't do it. So people sign away basically their rights for this. It doesn't happen. If you go to the drugstore and get a flu shot, you're not signing a waiver saying you can't sue anybody. But if you're in healthcare, you have to do this if you want to work. So she signed the waiver, she got the shot, and she got guillain-barré syndrome. That's a pretty nasty thing. As a matter of fact, she basically was out of work for 8 months. Out of work for 8 months. And get this. Because it was due to the flu vaccine, she didn't qualify for disability. So her insurance did pay some of the stuff. She had to go out on sick leave, and then for a while, nothing. Because she didn't qualify for disability, because the flu shot doesn't count as being disabled. Are you kidding? She's out for 8 months. Now, what does she get for that? For this year, at least, she got a letter saying she's excused from the flu shot. But based on these federal guidelines, there's no guarantee that she won't be excused from the flu shot from here on out. That's the stupidest thing I've ever heard. Now, let's compound this a little bit. My wife was supposed to be going out of town to work at a hospital in another state. She had to go through hoops to do all this stuff. She is basically a traveling worker, a technical. So she works with patients. She had to jump through hoops. She had to fill out all this paperwork. They made her take all these online tests. She actually had to go get a physical and a drug screen to go, even though she'd had one within a year. But this particular hospital said, nope, we have to have all brand new ones. She did all that stuff. She booked a place to live. She booked everything. And then a week before she leaves, she gets a call saying that the hospital was not going to acknowledge the letter she got from her doctor saying she's not supposed to get the flu shot. They were mandatory. And this woman starts asking her all these questions, which basically is against the law. We got this thing called ACA. Forget that. Let's go back to HICVA, the law from 1997, the Privacy Act, which basically says that these people, who are not HR people, by the way, don't have the right to ask her these questions. They just don't, but they did it. And so basically, she was done. She couldn't go to this place. And a couple of other hospitals have come up looking for someone, but they have mandatory policies. Then I get something to possibly go somewhere. And the first question I asked is, do they have a mandatory policy for a flu shot? Because I'm not getting it. And they said, yes, they do. Okay, fine. I'm not coming. I mean, I'm independent. I am incorporated. Am not a hospital employee. As a matter of fact, I'm not in patient care. The law states that it's people who are in patient care have to take it. So hospitals saying, well, we're just going to make everybody take it is ridiculous. Back in 2013, I was working in Memphis. I'm in an office park, not even close to the hospital, and they wanted everyone to take flu shots. I refused, but they needed me, so I got to wear a mask. There wasn't a lot of people who wore masks, but I wore a mask. And that was it. I was irked to no end. I almost up and left, but I didn't. So, hospitals have lost their minds. As far as the flu shot for everyone else, they've lost their minds. Here's some stats, just to let you know why I say they've lost their mind. So, they gave out last year, 2015, 146.4 million doses of vaccine. Now, I don't know how you get to 0.4. You know, as a matter of fact, I don't even know how you got to 146, because that would basically say almost half the people in this country got it, but that's not really what the numbers really showed. So I don't know where they got 146, unless they gave out multiple doses, which you're not really supposed to do, but they probably did. So, how many people died from the flu? You know how many people specifically died that they know of? 85. 85 children died because the federal government doesn't keep any statistics on anybody who dies from flu, because there is no diagnosis of death from flu. It can be for respiratory stuff. It can be for almost anything else, but it's not for flu. Let me turn my phone off. I didn't know that was on. So you don't die from flu. I mean, the children, they were able to do lab tests to find out, but they don't track any adults. Now, they estimate that it's anywhere from 3,000 to 49,000 people. How do you estimate from 3 to 49,000? You can't estimate that. So that's ridiculous. So they don't know how many people die from flu. They don't even know how many people actually get flu. They did a bunch of years ago. There was a stat out there, because I did a video in 2013, which I'm going to kind of link to here, where they said that out of 5.6 million people or so who went to the hospital or went to a doctor for flu symptoms that they thought they had, it was only 78,000 people who actually ended up having the flu. That is a very low number. That's not even 1% of the population of this country. So you really have no clue who has flu, unless, you know, they do all this, the lab work or whatever. You don't end up with a lot of people who have flu. You have people who have other stuff. And oh, by the way, they also include people who got swine flu or bird flu. Now, we don't have a lot of bird flu here, but it turns out we have a little bit more swine flu than I ever thought we did here. So that number gets included in here. Now, the effectiveness of the virus, of the flu shots, they estimate, because they don't really know, but they estimate that for what they call the A and B virus, I don't really know what these specific things are, but for the A and B virus, 47% effectiveness. That's not necessarily glowing. For the A virus, just the A virus itself, 41%. But they say the overall vaccine effectiveness was 55%. Now, I don't know where you get these numbers, but still, out of 146.4 doses given out in 2015, only 55% was effective. You know why it's only effective that way? Because they don't know. There's multiple strains, and they break the country up into these different districts, so to speak, and they guess what strain of virus they think is going to hit. And that's the shot you get. And they guess wrong sometimes. It's just how it is. And so you look at someone like me, I live in New York State. If I got a flu shot in New York State and it was good, but I get a consulting gig, well, in Memphis or in Indiana or wherever, it's a totally different shot. So now I haven't got the shot I need. They may try to give me another shot if I'm one of those people who takes a shot, but now there's that double dose of flu vaccine that you're not really supposed to get. But they don't care. Why don't they care? Because they get a waiver. You can't sue anybody anyhow. And look at me. I work for myself. I don't, my insurance, I have that high deductible. I have to buy my own insurance. So if I'm out for 8 months because of that, That's not going to work for Guillain-Barré syndrome. So what if I get the flu? You know what? If I get the flu, years ago, when they thought they had some kind of stat on adults who actually passed away, it was mainly older people who already had other things going on with them, or children. I'm kind of healthy. I'm actually doing pretty good. So I'm not going to die. I may feel bad for like 2 or 3 weeks, but I'm going to recover. You can't recover from some of this other stuff. I mean, I don't know if there's anything worse than Guillain-Barré syndrome other than it just outright killing you. But, I'll take my chances. Now, here's another weird thing. They don't track even how many people overall get sick, so they have no clue how many people actually get sick. So let's review this. They don't track how many people get sick. They don't track how many people die. They really have no idea of the effectiveness of the drug itself. They know that 85 children died in 2015, which, by the way, children's hospitals are exempt. Why are they exempt? Because they don't bill Medicare, so you don't lose any money. So they don't care. So Children's Hospital, this is the group who basically they know how many died. Of course, there's only 85 in the nation, but they don't have to take a flu shot, those employees, because they don't bill Medicare. Think about that for a minute. And then think about that waiver. And then think about how many healthcare personnel around the country have lost their jobs because they don't want to get the flu shot. And wearing a mask is fine, but some hospitals are saying no. This is one reason why I'm thinking about kind of removing myself from health. I'm thinking about it. I haven't totally gone that route yet because I find it amazing that I'm not in patient care. I help hospitals make millions of dollars, and they're worried about me as an independent not having a flu shot. You know who doesn't need a flu shot? If there's a problem with their plumbing and they have to call the big plumbing company to come do something, they don't have to test those people who come in and do whatever. Those folks are around a lot more people than I would ever be. Matter of fact, any services that have to be done within the hospital, electrician or whatever, that the hospital doesn't already have employees to do, they can't ask any of those people. Why? Because HIPAA. Oh, that's the name I couldn't think of earlier. They're not allowed to, but they need something done. So me, you know what? I show up in a hospital. I don't have to be in the patient care area. You give me an office, you send people to me. And for whatever reason, they don't want to do it. So this is my gripe. There are states. Rhode Island is a 100% mandatory state. They can do that. You people do know there's a nursing shortage, right? So you're firing nurses and you need nurses. Idiocy. Just plain idiocy. Now, I know there's going to be some people out there, because there were, a couple of people who wondered about the video I did some years ago when I'm saying, this is a scam, it's a farce, all this other kind of junk. You know what? I'm not the only one saying it. There's a lot of doctors who are saying the exact same thing. Yes, there are also a lot of doctors who are saying, well, you should get the flu shot just in case. Really? Are you going to come to my house and give me some chicken soup and some orange high C, if they still make orange high C? I'm thinking no. And now I got to pay you for antibiotics and all this other kind of stuff because I'm sick. I stopped taking the flu shot. I took the flu shot twice many years ago, and I got sick both times. No, you're not getting another shot at me. My wife reacts badly to things. And so you're trying to give her to take a shot. Ain't going to happen. It's false. It's a scam. It's like a lot of other stuff. This is a problem with healthcare in this country. Hospitals, physicians, clinics. They're totally messing stuff up. I have to think about my life. So anyway, this is what this rant is about. Let me know your thoughts. I'm not scared to hear from some other folks who may have a different opinion on this. But don't give me, well, it's safe. No, it's not. Don't give me that it's going to protect me. No, it's not. But you can try. Give it your best shot. Anyway, my name is Mitch Mitchell. I hope you have a wonderful week.